Hi, my name is Laura Pirelli. I've been studying about autism this past semester. I found it to be very interesting. We still do not know what causes autism, and there is no blood test or anything to help us. They believe that it is in some of the genes and that is genetic. The scientists have it down to a few genes. Um, Children who have autism display awkwardity in society with being social with people. They don't know how to talk to people. They don't know how to keep personal space. They have language difficulties. Sometimes they're delayed in language. Sometimes they develop language. And then they have repetitive swinging and swaying back and forth, repetitive saying sometimes. They'll listen to something and just come out and talk about it, and it won't really relate to anything. Some of the children look like they know a lot and talk like they know a lot and read, but they really don't comprehend what's going on. It's very important for parents and everybody to communicate, especially since once they know that the child does have autism, there's different assessments to help the parents um, see if their child does have autism. And when they do find out that they do have autism, early interventions the best way to go with that. So the child will hopefully be able to catch up with his peers of the same age. They get to go to early preschool where they will learn how to socialize, where they'll learn how to play. It'll help with development of language, and the children the children will get the help that they need to develop better. One of my interests that I had found that I wanted to find some research on, because I've worked as a paraprofessional for 9 years, and I've seen autistic kids go through, and most of them, when we use picture schedules, they do pretty well with that. But there was one that he was bright, but he just really didn't want to, I guess, be bothered. So I wanted to investigate to see, and we know that no two children, autistic or otherwise, are not the same. So, but it was interesting to see that Bandera and his associates found over time that the kids learn how to use the schedules, and as they go along, they start to do things on their own, and then the teachers are able to pull away the visuals, and then the kids are able to work on their own. Um, some of the researchers found that with the younger kids, there's not a lot of research on that. And also, they found that there's not a lot of research on children that are diagnosed with Asperger's. So we don't know if visual schedules would help them. But they had found, working with children that have Asperger's, because sometimes they feel overwhelmed with a lot of work that they have, that if you have a graphic organizer telling the kids where to put things, and then they can check things off, and they're able to stay on schedule and not be so overwhelmed where they're throwing tantrums. They found that using visual schedules, even picture exchanges or pictures to discuss needs and wants from the child to an adult over a lot of environments, is very helpful. The kids aren't overwhelmed, they're more calm, they don't act out, they don't throw tantrums, they don't hit themselves, they don't try to bite themselves. Hayes and Associates is the one that says that they need more research on the younger kids, like at the early intervention stage. They're also finding, Ma found, him and his associates found that visual schedules, dentists are starting to use these. So when the kids that who have autism come into the office, are able to understand um, what's going to happen with their teeth cleaning, so they're not having to be knocked out, that they're just giving them a mild sedative now and they're able to do the dental cleaning. They show pictures to the kids, and they said that they do this for a couple weeks before the children come in there, so they know, okay, this is what we're going to do and this is how we're going to do it and how long it's going to take. And then I found another researcher, Vaz, um, and he was looking at doctor exams to see, because the children that who have autism, when they go to the doctor's office, are overwhelmed with, there's so many kids running around and they're just overwhelmed with the environment. And he found that when the nurses come in, they go through the pictures with the kids of, we're going to weigh you. They talk to them, they look at the pictures, then they know that they're going to be weighed. They know that a doctor's going to come in. They know that they're going to look in their ears, and it helps the children become more at ease with what's going to happen with seeing all these pictures and being able to follow these schedules through. Um, I this year will have one autistic child that I know, and I was looking at his IEP, and they have used visual schedules. And he also has behavior problems and a few other things, but I believe, because of all this research and everything, and I feel really positive about it, that I'm going to use a visual schedule for him to keep him on track. I know that he does not like a changed environment, so I have the classroom all organized now because I don't want to frustrate him, and I want to keep him on schedule, and I want him to be able to work through the day using a schedule, and hopefully by the end of the year that he'll be able to do all this on his own. Um, but I'm also going to use positive reinforcement with him, because he does have a behavior problem, and it may be, from the environment and so much going on, but I'm going to keep him in a little area so I can keep him calm, and we're going to work with these visuals. And I'm not sure if he has verbal skills or not, but I see that they have worked on sign language, and I think we're going to follow up with that. So I'm going to do anything and everything I possibly can to get him calm and to give him the best future that he can have. And um, I just, I don't know. Autism is it's a give and a take, and you really, not one thing works for everybody. And I know it's hard, but we have to find the best intervention that's going to help the child. And I know that they don't like different routines, they don't like change, but sometimes, we have to do that to help them the best way we possibly can. I want to thank you for helping me to learn everything I can about autism, and I'm going to keep on researching and do the very best I can this year. Thank you.